Hi, everybody. Great to join you this morning on the territory of the Anishinaabe Algonquin Nation, joined today by several of my ministers here from British Columbia. I'd like to take a moment to introduce them to you for those of you who aren't familiar with these members of Team BC. We've got our Housing Minister and House Leader, Ravi Kahlon is here. He's a two-time Canadian Olympic hockey player. I think the Canucks were hopeful that he would play ice hockey instead of grass hockey, but we're glad to have him here. Josie Osborne is our Minister of Energy, Mines and Low Carbon Innovation. She's a fisheries biologist who was the mayor of Tofino. Attorney General Nikki Sharma is, of course, a lawyer. Her legal practice focused on representing Indigenous people, including survivors of residential schools. She's from Sparwood, British Columbia, a little mining town, where the top tourist attraction is a big green mining truck, the Terex Titan, one of the biggest in the world. The tires are taller than I am. And Brenda Bailey co-founded Canada's first women-owned and operated video game studio. She's Minister of Jobs, Economic Development and Innovation, which for those of you who are very fast with the pen is known in government by its acronym JEDI. So she's our Jedi Knight. And George Heyman is our Minister of Environment and Climate Change Strategy. I am told as a young man he spent time, 6 months as a matter of fact, in the woods as a logger, where he almost got crushed between two logs when he was setting a choker one day, which caused him to reevaluate his career, but his ability to duck has still paid off in politics as well. And then finally, most of you will recognize Murray Rankin from his time here in Ottawa as a member of Parliament. He's our Minister of Indigenous Relations and Reconciliation, and very wisely exchanged a commute of 4,000 kilometers for one of 4 kilometers. So his work-life balance has gotten much better since joining the provincial government. We're here in Ottawa for important bilateral discussions with Prime Minister Trudeau and his cabinet ministers. Many of the issues we face in British Columbia can only be addressed in partnership with other provinces and with the federal government. Everything from our challenges around climate change and the creation of clean energy jobs to issues in our healthcare sector and issues of homelessness and poverty. We'll accomplish more together than we will apart. And in BC, we certainly see this, the power of this approach in our work with Indigenous peoples. In BC, we're on a journey to true and meaningful reconciliation in which we're building long-term partnerships around everything from land use planning to economic development and moving away from those short-term transactional relationships. Part of that involves recognizing the jurisdiction of Indigenous people in British Columbia and their rights to self-determination, and we've seen evidence of the success of that approach recently around our agreement with the Treaty 8 First Nations. I'm very excited for my colleagues and I to be meeting with the Prime Minister and federal ministers. I have a great deal of optimism about the business that we're going to do together. Prime Minister Trudeau has been a good partner on many issues in the past, and I'm hopeful that we'll see progress next week as well on the critical issue of healthcare funding transfers. As premiers, we've made our position on the healthcare funding transfers very clear. The sustainability of our public universal healthcare system depends on having a strong federal partner at the table, and our system's under strain. The global pandemic put huge pressure on our healthcare workers, and the areas of greatest strain certainly around access to family doctors, utilizing home care, long-term care, and seniors care to take pressure off our hospitals and free up beds, and in our streets and communities, issues of mental health and addictions care. Critically important. We're working overtime at the provincial level. We're not waiting for the federal government in BC to address these pressing issues. We're building hospitals, urgent primary care centers. We worked with Doctors of BC on a new model around family physicians to attract and retain family doctors and encourage them to take on more patients. We're also streamlining the process for international doctors and nurses to be able to get into our system much more quickly and practice in British Columbia. In BC, we believe that public health care is one of our nation's great achievements, and it has to be strengthened so that everyone gets the health care they need when they need it and where they need it. And strong, stable federal funding is the key to that. And the only way we're going to get there is sitting around the table. That's why I'm very much looking forward to our meeting coming up with all the premiers. British Columbians have really endured the impacts of climate change in very significant ways. We've had floods, extended droughts, a heat dome, and record wildfire seasons. And we're investing record amounts in our Clean BC roadmap to 2030 to respond, one of the strongest climate plans in North America. We're charting a path that very much aligns with the federal path of their price on carbon pollution, including measures to support the transition to a clean economy. We also value our land, water, and wild spaces. That's why we live in British Columbia. And just last week, we protected the Incomplu Valley, which is a rare inland temperate rainforest with remarkable old growth. It's the most significant new protected area in our province in a decade. Economically, our province is a place of opportunity. We have a record number of people moving to our province. We set a record last year. We're on track to set another record for in-migration to BC from other provinces and places around the world this year as well. The reasons are right there to see, setting records around mining exploration in our resources sector, hydrogen economy growing remarkably, our biotech sector, we're the gateway to Asia for Canadians and vice versa for international trade. Our clean electricity is widely available, cheap, and zero emission. And as a result, we're in a very good place to lead on climate change prevention and response and to support national and international efforts around climate change. We're going to continue to do this, even as we continue to grow a sustainable economy where our government believes no one should be left behind. So, for example, our forest sector is under remarkable strain right now. We have been dramatically impacted in the forest sector by beetle kill, by forest fires and a shortage of fiber supply. And by working with industry, though, we've found ways to move forward. I was just in Crofton at a mill, a pulp mill, that had laid off 100 workers. We got those workers back on the job to manufacture paper products that will reduce single-use plastics. And that transition resulted in the recovery of all of those jobs. And that was a partnership between the province and the federal government to help them retool to save those jobs. Together, we can deliver results that make a real difference in people's lives. I'll certainly be raising issues around safer communities in these meetings as well, as will my colleagues. Everyone deserves to feel safe in the street, in their communities, and in their homes, their businesses, at school. And for many British Columbians, front of mind is the issue of repeat offending and violent stranger attacks in some of our major centres. And these, we believe, are the unintended consequences of some changes to the federal criminal code around the availability of bail and some subsequent Supreme Court of Canada decisions. We've expressed our urgent concerns about needing the federal government to come to the table and to make those amendments that are necessary to the criminal code provisions. But again, not waiting for the federal government, we have a Safer Communities Action Plan that ensures that those who commit violent acts face consequences. But also, British Columbians recognize, as I think most Canadians do, that underlying many of these offenses are issues of serious mental health and addiction. So addressing those issues is also a priority for us through, for example, peer workers that respond to some mental health calls now instead of police, freeing up police to focus on crime and providing de-escalation services and connection to services for people that are sick in our communities. The federal government is certainly aware of the seriousness of this issue across the country. I've seen the news out of Ontario. I've spoken with Premier Ford about this issue. We've spoken about it at the Premier's table as well, and we'll continue to press Ottawa on this issue to ensure that the public can have confidence in their justice system. Housing is another top-of-mind issue for British Columbians and across the country. We're making the largest investments in housing in our province's history, $7 billion over 10 years. Our government is moving directly into providing affordable and attainable middle-income housing in British Columbia. We have 36,000 homes either completed or underway through BC Housing, our Crown Corporation that delivers housing in BC, but still more urgent action is needed to open up homes for people. We have passed the Housing Supply Act, which creates new tools for us to work with cities to ensure that they are approving the housing that's needed for our population growth to speed up development. On our provincial side, we're fast-tracking housing permits and finding ways to expedite permit approvals related to housing. We've made amendments to the Strata Property Act, which had restrictive provisions allowing discrimination in in making units available for rentals. We have a speculation tax that opened 20,000 homes that were previously vacant, and that's just in the Lower Mainland. We didn't get into the housing crisis in British Columbia or in this country overnight, and we won't end it overnight, but we will continue to take strong action on this to address this issue for British Columbians, and a federal partnership on everything from their municipal acceleration fund that they've announced to housing on nation, on reserve for Indigenous communities in our province. There are great opportunities for us to continue to work together and expand that work. That's how we'll build a stronger British Columbia for everybody in partnership. And all of us coming together from varied backgrounds and experiences, we all share in common a vision for a better life for British Columbians and for all Canadians. And I look forward to our meetings. So I'm happy to take any questions you may have.
Where do you stand? Premier Ford out of Ontario has talked about a role for publicly funded procedures in the private healthcare system. Going into these talks next week, where do you stand on that idea, on a role for the private sector in healthcare?
We are going in a different direction in British Columbia. We've been buying private clinics, especially imaging clinics, to bring them into the public sector. We believe that allowing people to buy their way to the front of the line, which was previously what happened with these imaging clinics, doesn't change the fact that there's a line, it just changes who's at the front. And so that approach has assisted us in working through significant COVID backlogs. Specifically on surgical clinics, we do have private clinics that do public work for British Columbia, but we are not expanding that work. In fact, we're looking for opportunities to use public clinic models to take pressure off of our hospital system rather than expanding the private sector.
And as a follow-up to that, the federal government has been looking for accountability in sort of money they provide for healthcare. Like, what's your position going into the talks on sort of opening up and letting the federal government see how healthcare is working out? And by the way, are you optimistic about these talks leading to a deal?
Well, it's been my firm belief, it was my predecessor's, John Horgan's firm belief, that we needed to be around the table to get to a deal. And that was the only way we were going to get to an agreement with the federal government. So I'm very optimistic that that barrier has been overcome. We're going to be sitting around the table. The Prime Minister says he's coming to the table with a proposal for premiers and starting that discussion. That is essential. We're not going to get to where we need to get without that face time and sitting around the table and working things through. So I do feel optimistic about it. And I'm fully prepared to engage in those discussions with my colleagues.
And on accountability?
Accountability is critical for us, both to the people of British Columbia through better data, through better tracking initiatives that we have underway at the provincial government level, and happy to have those conversations with the federal government to make sure that everybody can have confidence about what's happening in our healthcare system in British Columbia.
Upcoming healthcare summit, some First Nations leaders have voiced discontent at not being invited. What's your thoughts on that?
So in British Columbia, we have the First Nations Health Authority, and we work very closely with them. We work with the First Nations Leadership Group, which represents all Indigenous leadership on areas of shared priority and concern. And so Indigenous leadership is part of all of our work related to healthcare, certainly, but not exclusively. And so they will be part of the British Columbia approach to responding to healthcare. Indigenous communities in our province have disproportionately poor outcomes in the healthcare sector. And we're also doing a lot of work about anti-racism in our healthcare system. A lot of Indigenous people reluctant to engage with the healthcare system because of experiences they've had. We had a report called In Plain Sight that looked at the experiences of Indigenous people in our healthcare system and how we can improve that. So that's a big focus of our work. And if there are opportunities for us to support other provinces and building those relationships with Indigenous communities, we're happy to engage in those conversations. We're not perfect, but we have some experiences to share, and certainly Indigenous communities in our provinces have that to share as well.
Should they have been invited, though, in your opinion?
Typically, for bilateral provincial federal funding, it's the federal government and the provincial government. But from British Columbia's perspective, that funding that we access, the bilateral agreements with the federal government, will be strongly informed by our engagement with First Nations.
Premier David Eby from Global News. Welcome.
Hey, David. Nice to see you.
There's been some discussion, mostly at the federal level, that the federal government may seek to do essentially one-off deals on healthcare with the provinces, much like the child care arrangement, that BC and Canada would come to some arrangement, Canada and Manitoba may come to a different arrangement. as you begin these discussions, is that at all a consideration for British Columbia, that you'd be open to just a unilateral, a bilateral deal between Canada and BC, and other provinces can make their own deals?
Well, what I understand is coming forward, and it's very, I think that a lot of the detail is going to be filled out. I hope a lot of the detail is going to be filled out around the table. Is that we'll be talking about core funding for provinces, but the ability for provinces to have discussions with the federal government about key areas of provincial priority. I am convinced that BC's priorities are not necessarily the same as Quebec's, as Nova Scotia's, or Newfoundland's. And so the opportunity to have those bilateral discussions is important, but the structure of that and what the details are also going to be important. So we'll be having those conversations as premiers around the table once we hear from the Prime Minister about what the proposal is, and we'll go from there.
And just a question about BC being a good neighbor so far as health goes is, we've seen Minister Dix try to encourage nurses from other jurisdictions, for example, come and work in BC. And we're seeing other jurisdictions sort of amp up, come and leave your province and come and work in my province. What do you think about a federal government that might put some sort of, make it more difficult for provinces to provide enhancements and enticements or whatever to attract healthcare workers from other provinces, have not provinces say they can't afford in some cases to compete with the likes of BC or Ontario?
So from the British Columbia end of things, we know it's absolutely essential to get more workers into the healthcare system. And so we've been focused on near-term, medium-term, and long-term approaches to this. In the immediate term, we have somewhere in the neighborhood of 2,000 nurses at our College of Nurses, internationally trained nurses with experience who want to practice in BC. And so we've worked with the College of Nurses to reduce their wait time from 2 years to 3 to 9 months. And we're paying all of their costs up front, so there's no financial barriers to them coming to British Columbia, because we know that there are 5,000 nurses who are thinking about coming to British Columbia. And so that is the pool of nurses, for example, that we're looking at. Same for international doctors. We have doctors who are not working in the medical field in British Columbia. They're ready to work. We worked with the College of Physicians to create a category of work for them under the supervision of a BC doctor, so they can get to work right away in the health sector if they meet certain standards, because we're not going to reduce our standards, but we do want to recognize the experience that people have in our province. We're also opening that's the short term. The medium term to long term is we're opening the first new medical school in Western Canada in 50 years, which will be focused on community care, nurses and physicians trained and focused on delivering healthcare in community. And also we've opened new spaces at UBC and other post-secondary institutions for nurses, 600 new spaces for nurses. So our plan does not depend on taking medical professionals from other provinces. And in fact, if we do that, we're in a race to the bottom with other provinces. We have to bring more people into the system, and BC is going to pull our weight on that end.
Premier, the other premiers have talked previously about looking to get 35% of the cost of health care from the federal government, commitment that adds up to about $28 billion. I'm wondering if you have any view on the reasonableness of that commitment, and if you expect, I know you haven't gotten the details, it sounds like, from the Prime Minister, but do you expect him to hit that dollar figure? Is anything less than that dollar figure acceptable to you?
Well, I'm very much looking forward to see what the federal government and the Prime Minister is going to be bringing to the table. I, along with many of the premiers I've spoken with, are keen to reach an agreement with the federal government that recognizes the critical role the federal government plays in being a strong partner at the table and recognizing the impacts of growing populations and inflation on our healthcare system. Their share has dropped year after year after year. And so we'll have that conversation around the table. And I'm very hopeful that it's a good offer for the provinces so that we can advance that discussion together.
I mean, maybe as it's more broadly, what does a good offer from the federal government look like? What do you think it needs to contain?
Well, critically, certainly from the British Columbia perspective, we need core funding for our healthcare system. We're putting the resources in to bring those nurses on, to bring those family doctors on, to open those healthcare centers, to open those new hospitals. And that comes at the expense of other programs in British Columbia, education, for example. And so if we're pulling money all into the healthcare system and we don't have that federal partner, it leaves less on the table for other priorities that British Columbians have. So critical for us is that core health transfer money. And then the secondary piece is recognizing the shifts that have taken place around healthcare needs in British Columbia. We have a very serious mental health and addiction crisis in our province. This is an area of healthcare that has not been the focus of the public healthcare system for a long time in Canada. We also know that home care can save a huge amount of money by getting people out of hospitals. We have a rapidly aging population in British Columbia, so long-term care is vital as well. So those two components of that critical funding for the core healthcare system, that acute care system, as well as the mechanisms that are going to improve the quality of life for British Columbians and take pressure off the system through our bilateral discussions. Those two components are going to be what we're looking for. And I know that's not a unique perspective because all premiers are hearing from their residents. I'm certainly hearing from British Columbians they want better care. And they expect that both the province and the federal government are working together on that.
Can I just follow up on, and forgive me if someone from your government talked about this yesterday, but long-term care homes, the federal government may be proposing voluntary guidelines for long-term care. There was a lot of discussion in the last federal election that those things ought to be mandatory in terms of long-term care. And whether or not long-term care funding should also be part of these discussions on Tuesday. So I wonder if I can get you to talk about whether you think the country should have mandatory long-term care home standards, and whether or not the federal government should participate more fully in the funding specifically for long-term care homes.
I think for a couple of reasons, both because of what we saw in the pandemic, the horrific images of seniors abandoned by care home operators, as well as the basic belief that certainly our government has that everybody who needs long-term care, whether because they're a senior or because of a profound disability, has a right to a basic standard of living, that these are very reasonable things to have standards for. You know, the number of baths that you get in a week. These are basic things that people deserve. So our government did put in, at the provincial level, additional resources to meet our own provincial standards, because when we formed government, our province was not even close to meeting standards around basic services for seniors. But we also know that during the pandemic, we lost a lot of long-term care workers from the system, and that system is very much under strain. And so we've brought a number of the private healthcare workers back into the public system so that we can monitor and ensure high standards, that they're earning decent wages, and improved standards in our long-term care facilities. But that's not free. And a federal partnership on long-term care would help us expand that work and hit those targets and meet those standards that every senior deserves in British Columbia.
What are you hoping to, you're meeting with the Prime Minister today, obviously ahead of the major meeting next week. In the health piece of your talks today with Mr. Trudeau, like what are you hoping to accomplish with sort of that piece of the talks today? Are you hoping for a preview of the larger deal? Are you hoping to sort of get something in as the Prime Minister fine-tunes his proposal?
Well, I think for my meeting with the Prime Minister, we'll be canvassing a number of different issues, which I outlined around housing and healthcare and strong economy and so on. But for the healthcare piece, I really see this as just one more opportunity to underline for the Prime Minister the critical nature of the federal government coming to the table with all the premiers on this, but also BC's priorities: mental health and addiction care, long-term care and home care for seniors, family doctors, and support for getting those workers into the healthcare system that are so desperately needed, so that he's aware in whatever he's planning on proposing on the bilateral side, where British Columbia will be going and what we'll be asking for. I don't want any surprises.
Are you concerned you don't have an outline of this deal, and you're a week away from these big talks? You don't know what the Prime Minister is going to put on the table?
Well, certainly it is. It's always preferable to go into the meeting understanding what the parameters are. But I have to say, for myself and for British Columbia, I am glad that we've overcome that hurdle that stood in our way for too long of not even sitting around the table talking about this. I'm optimistic going into this meeting that the federal government will present a reasonable deal that will form the basis of discussion, and that we deliver for British Columbians. British Columbians do not want to see the federal government and the provincial government in a bun fight about healthcare dollars. They want to see us deliver for them care in their communities. That's the mandate that I have from them, and that's what I'll be bringing to the table, and I know I'm not unique among the premiers in that perspective.
Pierre Poilievre this morning, a few floors below us, sort of denounced what he called the Trudeau NDP, and I think he meant provincial NDP, approach to decriminalization and harm reduction issues, calling it a complete disaster that's resulted in quote-unquote hell on earth in Vancouver and British Columbia. Obviously the opposition leader did a video on a beach in Vancouver some time ago as the Premier. I wondered if you had any comment on Mr. Poilievre's views.
Yeah, in British Columbia, we're in a very serious addiction crisis. The drugs that come into British Columbia have gotten profoundly more toxic since the start of the pandemic. Our deaths were trending down in the lead up to the pandemic, and then post-pandemic we've seen them skyrocket as drugs like carfentanil have gotten into the system. And our goal is to save lives, to get between the predatory drug dealers and people with serious addiction issues, and we want to get in between those two groups with nurses, with doctors. And so part of that is around our Safe Supply initiative. Part of that is around saying to people, look, if you're addicted to drugs, illicit drugs, illegal drugs, you can talk to a nurse, you can talk to a doctor, you can test your drugs to make sure they're not going to kill you without fearing that the criminal consequences. We want to reduce those barriers. But all of this work is with an aim to keep people alive so that they can get into treatment, so that they can get the support that they need to hopefully turn their lives around. I hope very much that all parties focus on an evidence-based approach around drug policy, because when you talk to parents who have lost a kid who thought they were taking some kind of a party drug at an event and ended up taking fentanyl and dying, you understand how serious this issue is and how it crosses partisan lines and how we all need to work on solutions. And it does come back in part to this healthcare funding and the need for support around seeing drug treatment as part of our healthcare system.
Can I ask the Minister of Indigenous Relations just a quick question? Just wondering if you're, are you meeting with your federal counterparts here, and are any particular issues that you want to broach with them?
Well, thanks for the question. I have essentially three federal counterparts. I'm going to be meeting with Minister Hajdu, along with Minister Heyman today, meeting with Minister Mark Miller tomorrow, and of course Pablo Rodriguez. Minister Rodriguez has responsibility for Indigenous languages. Won't be seeing him this time, but of course we've been in touch on Indigenous languages. Yes, we have a number of issues. We're close to some modern treaties in British Columbia. The Premier mentioned work we have recently done in Northeast BC with Treaty 8, to deal with the settlement of a lawsuit where a court found that there was a breach of that treaty through the cumulative impact of resource development. We'd love some federal support on that kind of initiative. And so many other issues, because of course, at bottom, Indigenous issues are their federal responsibility, but of course we all in British Columbia want to support things like housing and other initiatives. But of course I'll be speaking with those people about a variety of issues.
Now, the Conservative leader also mused about resource revenue sharing. He was in Vancouver about a week and a half ago. What's your thoughts on that? Is that a road that your government wants to go down?
Well, he talked about the Indigenous Tax Commission. He talked about some of the other initiatives that have been in place for a while. And I noticed that some of our prominent Indigenous leaders were there. I'd like to talk to them first before I formulate any response, because I don't know what their position will be on some of the things that he said. So obviously we're going to study the impact of what he said. Excuse me.
Do you miss the 4,000 kilometers?